I noticed this Mercedes during my shift. She came in and poked her head around and checking me out on what I was doing. And I was kind of suspicious what she was trying to do.
I saw this nurse and I'm like, wow, that's how I want to practice.
She put in a request to have me as her preceptor. And I asked, like, why?
I knew the kind of nurse that I wanted to be. And I saw this in this person.
I said yes, but at the same time, I told her, frankly, I have very high expectation and I attend to detail. I will not expect less from her. Basically, I want to scare her away. But I didn't scare her away. And she said, that's exactly what I want.
I was born in Jamaica in a small place called Harmons. I grew up with my grandmother and 3 other children. We didn't actually have any electricity. Even though we didn't have much, it was a very fun time. My fun memories of growing up there, going to school, walking to school. And in my final year of high school, that was an option for me to explore coming to school in Canada. Because my dad lived here, I actually applied to Mount Royal as an international student. And I was accepted. My goal at the time was to work in the hospital because I was told that working in the hospital is always a good career choice. I think my present role that I'm in as an enterostomal therapy nurse is, I would say one of the areas in nursing with most rewards. Some of these patients, they may come in, they have a diagnosis of cancer. So you can imagine how scared, the grieving process that they're going through. So this is why, as a nurse, when they're very ill, we're there to help to guide them and follow them through their journey.
I count myself lucky if Mercedes is the one taking care of my patient. She's just an incredibly positive person, and when you've done a big surgery on somebody, that's what they need. They need a positive influence so that they can get better and go home.
My name's Gary Drage, and I'm here today because of the relationship that we established with Mercedes. She was a professional that I got the sense of that she really did care about you as the individual, as opposed to, well, you're number 16 today, let's get you done and get the heck out of here. How she deals with people is her. And she uses her education with her own personality to make it more helpful for me.
She's wonderful. We actually look forward to our visits with her. How often can you say you look forward to a medical visit? But she makes it enjoyable, informative, and pleasant.
She was assessing one of my patients post-operatively. She called me and she said, he just doesn't look good. And I said, Mercedes, I'm over in the clinic, bring him over. She brought him over herself in the wheelchair to my office and stayed there until she knew that I was going to take care of him. And in fact, I saw him and immediately took him down to emergency myself. But I can't think of many people that would leave what they were doing and actually bring a patient in the wheelchair all the way to my clinic. And that's what she'll do.
So how about...
We have more patients than we do beds. We also are seeing more acute patients. So in other words, they're sicker than they used to be. I think that her focus is the patients, it's what's best for them. So she really focuses on those particular areas that are very important in that role. But I think as an advanced practicing nurse, you can't just look at what the patient came in with, you have to look at the whole process.
Leanne, do you want to start at foot? Sure. Sitting at 91% capacity using, I think, 11 OC spaces. Okay, thank you so much, Leanne.
Today I'm actually what you call a site manager, so I'm the administrator in the building. So I manage capacity, which means that I manage the flow of patient from emerge up to the units and also the discharges of patients to balance things. You've discharged all your patients? Yes. Along with that, it's also a lot of team effort, working along with charge nurses, admitting clerks, doctors. So for example, if there's any patient concerns, I may be called by the charge nurses to speak to the patients and handle their concerns. And I think that's the beauty with nursing. Nursing is so diverse. As a nurse, you have that foundation, but you're able to use that knowledge to grow into different areas. You can be a manager, a nurse manager. You can be a nurse director. You can be a clinical nurse specialist. So nursing is very diverse. And I actually encourage new people considering this career for those reasons. I remember meeting Michael. I used to work at the Bay. And one day I remember I was walking and he and his friend was driving past. So I was walking. We were going opposite to each other. It's a warm day. And then I got to where I was going, and then there he turned back with his friend.
She's very outgoing, likes to dance. I remember that. You know, she would go dancing every Wednesday night.
And then he came across to me and came close enough to give me a kiss.
It was a blessing when she met me. So.
Michaela, she's full of energy. I think that's the main thing if you meet Michaela. Yeah, she's a joy. I'm more like her, like what you call it, her playmate. Because she's the only child at home. And she had her birthday yesterday. I'm always telling Michaela, we're not twins.
Thank you for getting the education that you got. Thank you for applying that education, because you made the process after the operation an easier one to deal with for myself and my wife.
She gives her heart to her patients and patients' family, and also had a great passion in offering her knowledge to students, to her other colleagues.
I think that she has a caring nature. She has a good attitude. She is committed to her role. She's committed to the patients. She's committed to doing the best job possible.
She seems to be willing to accept challenges, face them, overcome them, and then look for new challenges.
She's just an outgoing person. You know, love life, love to have fun, love school, you know, always trying to better herself.